Go.
Knock, knock, knock. Hi, my name is Claire. I'm one of the family nurse practitioner students at Texas State University. I'm going to be doing a little bit of a health history on you today. How
Great.
are you?
I'm very well. I'm good.
Good. I'd first like to get to know you a little bit. Tell me a little bit about yourself.
Yeah, so my name's JB. I'm 30.
Okay.
For the most part, healthy. Not much going on with me just the last week or so. I feel like I've had, progressive, scratchy throat. It's sore a little bit, and I do a lot of talking.
Okay.
So that's made it worse. But I talk a lot in personal and professional. And then just like a runny kind of nose. I've been congested, so I decided it was time to pop in and see you.
Okay, well, I'm glad you came in. I'm going to go ahead and start with a full head-to-toe physical assessment, of course. Just want to make sure I'm getting everything and make sure I get a good health history, okay?
Yeah, absolutely.
All right. So first and foremost, do you have any allergies to medicines?
Nope, none that I know of.
Okay. Any allergies to environmental or tactile things?
No, other than when the seasons change,
Okay.
I sort of experience all of this.
Okay.
That's
So you saying you're having kind of some nasal congestion and like kind of runny nose?
Yeah,
And then a sore throat?
yeah.
All right. When did this start?
I don't know, a little less than a week ago.
Okay. And is it just in your throat and your nose? There's no like itchy eyes or cough or anything like that?
No, not really.
Okay. And you said it's started about a week ago. Was it a sudden onset or more of like a gradual onset?
More gradual.
Okay.
And then because I tend to talk a lot throughout the day, it really exacerbates my throat.
Okay.
Symptoms a little bit, so.
And so that's kind of something that aggravates it is talking a lot?
Yeah.
All right. Has anything helped at all? Have you tried anything?
Yeah. So, for like short-term relief, I can take some like Claritin or Zyrtec.
Okay.
Zyrtec, yeah. And then, throat lozenges help a
Okay.
lot.
So those kind of help alleviate a little bit of the symptoms, but not really long lasting?
Yeah, exactly.
Okay. All right. Do you think that you could rate the severity of your pain, or discomfort? I know you're not saying you're in a lot of pain, but
Yeah.
it sounds like it's annoying and bothering you in your life. Like a 0 would be you're not bothered at all and you're going about your daily life with no problems, and 10 would be you're debilitated and not able to do all of your daily activities like you normally would.
I would say probably about a 5.
5. Okay.
Yeah, just because of it being in what feels like my head.
Okay.
It's on my mind constantly.
Okay. Got it. So it's just kind of there all the time and just nagging.
Yeah, exactly.
All right. With the pain in your throat, is it sharp, shooting, kind of constant? dull?
It's constant. I would say, I don't know. When I talk a lot, it can be a little bit more severe.
Okay, just kind of like a dull pain.
Yeah.
Not anything that's really obnoxious, it sounds like.
No, not at all.
Okay,
Just
good.
more of a constant irritant.
Understandable. Let's kind of transition into your health history then.
Yeah.
I know we already went over your allergies, but do you have any medical history, like diabetes or high blood pressure?
I have asthma.
Okay.
I've sort of always had it. So I have an inhaler,
Okay.
albuterol inhaler. And then I have anxiety.
Okay.
And I take Paxil every day. And then if it gets a little out of control, I take Xanax.
Okay.
Yeah.
With your asthma, does anything like make it worse, or do you know any triggers?
Yeah. Oh, exercise.
Exercise.
Go
Okay.
figure, right?
Yeah, that's unfortunate. It's like we're supposed to be exercising, but somehow it's just not great for our bodies at the same time. But have you had any asthma attacks recently?
Not recently. No.
Good. And you said with your anxiety, you take Paxil every day and you take Xanax whenever you feel the need. Is there anything else that you do that helps?
Yeah, I started going to therapy once a month just to sort of bring myself out of the triggers and sort of recenter myself.
Okay.
And I think it's really helped.
Awesome. That's so good to hear. It's
Yeah.
nice to feel like something else besides medications can help with that kind of thing.
Yeah, absolutely.
Wonderful. Kind of going on into more of health history, you said that those are the medications you take. Do you take any other medications, like herbal supplements or
Yeah. I'm in my 30s now, so I take fish oil, vitamin D, a multivitamin, and calcium.
Awesome.
Yeah.
That's great. That's really I feel like that's a great way to contribute to your health. That's not something pharmacological.
Yeah, absolutely. I agree.
Wonderful. Have you ever had any surgeries before?
Yes, I have. I've had my tonsils and adenoids out. I've had tubes. I had my appendix out.
Okay.
And my wisdom teeth.
Okay.
Yeah.
So most of those are pretty normal. No, it sounds like no traumatic injuries or anything. And have you ever had any hospitalizations?
No, not other than sort of those
Surgicals.
Yeah.
Understandable. So it sounds like you probably haven't had any blood transfusions or blood products?
No, none.
All right, wonderful. And with those surgeries, did you ever have any problems with anesthesia or coming out of the surgery?
No.
Everything went smoothly?
Yeah.
No problems with recovery or signs of infection or anything?
No, never.
Fantastic. Well, your body must be doing a good job.
Well, I think it tries.
Awesome. Have you ever had any illnesses, like childhood illnesses or things you'd had to be, quarantined for or anything?
No, nothing like that.
Have you had like measles, mumps, rubella?
Chickenpox.
Okay.
Yeah.
Wonderful. That's awful, actually. But does that mean that you've had any signs of shingles recently?
No,
Okay.
never.
Do you know when you had your chickenpox?
Oh God, I would say I was under 10.
Okay, perfect.
Yeah.
That's fine. No problems with that, though. You didn't have to go into the hospital with it or anything.
No.
Good. Kind of leading into that, are you up to date on all of your immunizations?
Yeah, so I've had all my vaccinations, and then I've also had Gardasil.
Okay, for the for HPV?
Yeah, exactly. I did all 4
Awesome.
of the treatments.
Do you do you get a flu shot annually?
I do, yeah.
Yeah. Do you know which one you take?
Quad.
Okay, so the
yeah.
quad strain.
Yeah.
Got it. Have you had a pneumonia vaccine? Normally, you don't because you're underage.
Not that I know of.
Okay.
But.
That's fine. That's perfect. Normally, you only get those when you're like older and you're highly susceptible, but something we have to ask.
Yeah. Of course.
Just wanting to know about like your health, and as long as you're taking care of yourself, that's great. It's really good that you get a flu vaccine because it's, it cuts down on the likelihood of you getting it and also the likelihood of you passing it to somebody else that could have possibly been immunosuppressed, like our elderly, or if you have friends with babies or anything like that. It's good to get the flu shot, so I'm really happy that you are.
Oh, thanks.
Yeah. Other than that, I kind of would like to transition into our family medical history.
Yeah.
Do you know very much about your family medical history?
I do. So my mom is she's amazing. She's a breast cancer survivor.
Oh, wonderful.
Yeah, so 15 years in remission.
Good for her.
Yeah. She did, the lot of it, surgery, chemo, radiation.
Okay.
She has hypothyroidism as well.
Okay.
And asthma.
Oh, well,
Yeah, that's sort of...
kind of makes sense, trickling down there, huh?
Yeah, exactly. And then her mom had hypothyroidism
Okay.
and depression.
Okay.
And I think maybe asthma.
Yeah.
I can't.
That's okay. I know it's
Sorry,
hard
I'm
to
like
keep
trying
up
to remember. And then
Did her mom have any cancer or diabetes or anything like that?
I think she also was a breast cancer survivor.
Okay.
Yeah, that's right. I remember her telling me.
So it's pretty hereditary, it sounds like.
Yeah, I think it is.
Yeah.
But I give myself breast examinations every month.
Way
Yeah.
to go.
Yeah,
I'm
we
so
did
proud
it.
of you. That's one of the best things to do, especially with the family history.
Yeah, so that's the main reason I do it, and I stay up to date on my annual exams
Oh,
with
good.
my gyno too. So
Good.
yeah, and then my grandfather, he passed away fairly young. I think like 47.
Okay.
From a motor vehicle accident.
Oh,
So
sorry to hear that.
yeah, but I do believe he. Oh goodness, I get them mixed up on one. Either my grandmother had asthma or has asthma, or my grandfather did. But it's on my mom's side.
Okay.
And then on my dad's side, my dad has mitral valve prolapse, and he's had gout and AFib.
Okay.
Yeah.
So a little bit of cardiac history there.
Mm-hmm.
I'm sure, is he doing well then?
Yeah, my dad's
Good.
doing great. He's doing wonderful. His father is no longer with us, though.
Okay.
He passed away. He decided not to pursue treatment with pancreatic cancer,
Okay.
but he also had COPD, emphysema. Oh my gosh, it is eluding me now. Gout, mitral valve,
Prolapse
prolapse.
as well.
Yeah, as well.
So that sounds hereditary, huh?
Yeah, it definitely is. And then I think, and his mom, I'm trying to remember, his mom, she had breast cancer,
Okay.
and she survived it, but she actually passed away from complications with Alzheimer's.
Oh, okay.
And I'm sure that I might be missing
Yeah.
a little bit there.
It's really hard to not only know your health history, but also try and remember all of your families, especially as we get older, we end up having a lot more going on, and especially if your grandparents live to a longer age, it's harder to kind of keep up with those. But if you know the basics, it's really good to at least know like what seems to be hereditary in your family, so that you can let us know, especially as like primary care providers. We want to make sure that we're checking things and making sure that we're being proactive and making sure that we're being really up to date on your preventative health care.
Yeah,
So.
that makes sense.
That's great. Thank you for sharing. I'm so
course.
sorry that it sounds like you've had a little bit of death in the past, but it sounds like they were all really, really great, strong people. So.
Yeah, I like to think so. And, my parents couldn't be better, so I'm really,
Yeah.
really lucky.
Seems to make you a really strong girl.
I try. Tell my brothers that.
Speaking of, you have two brothers?
Yeah,
Three brothers?
two. I have two brothers.
Two, okay. And are they in good health?
Yeah, they're perfectly fine.
Good.
I mean,
good.
as fine as guys can be, but
Of course, I'm sure boys will be boys.
exactly. But yeah, they're great. And we're all super close, so.
Good. I was going to
That
ask,
makes sense,
do you have like a good support system? Do you feel like they're really there for you if you need them?
Yeah, I definitely do. I mean, they all still live back in Tyler,
Okay.
but which is where I'm from.
Okay.
They all still live back there, but yeah, I mean, they would do anything for each other and for myself, like in a drop of a hat, so it makes it easier.
Good. So kind of transitioning, I want to know a little bit about where you're from and kind of like your home life. You said you were born in Tyler.
Yes.
Is that where your family still is then?
Yeah, that's where my family still is located, and they come and see me pretty frequently. I actually moved down here to go to Texas State.
Oh.
Yeah, yeah, Bobcats.
Go Cats.
I know. And I graduated with a business degree,
Okay.
and then in marketing, and then found my way into finance, and
Wow.
that sort of kept me in Austin. Yeah,
Way to go.
I know.
Do you feel fulfilled in your position, and do you feel like you're happy with your work life balance?
Yeah, I mean, it's finance, so it's always a bit more stressful.
I can understand.
Yeah, and you're always sort of interacting with people.
Yeah.
So if I am sick or if I am stressed, I don't give my body sort of that time.
Yeah, I'm
But-
sure it sounds like you talk to a lot of people all the time, and with this sore throat, it's probably not helping any.
Yeah, it's been a hindrance. So I was like, I'm just gonna go in.
Yeah, well, I'm glad you came in.
See
Let's
someone.
hopefully we can get a plan in place that we can, alleviate some of these symptoms and hopefully in the long term get you feeling better.
Yeah, that sounds perfect.
Wonderful. So some more stuff about at home. Are you single, in a relationship, married, divorced?
I'm in a relationship,
Okay.
monogamous.
Okay.
We don't live together. I actually live with my 9-year-old dog.
Oh.
Yeah, she's amazing. She's
Good.
got the energy of a puppy. But I am, in a committed relationship. if you
Good.
will.
Are you guys practicing safe sex?
Yeah,
Have
we
good
are.
conversations about good sexual health.
Oh, absolutely. I mean, at my age, you just have those conversations.
Right. Thank goodness a maturity thing.
Seriously.
Kind of leading into that, and you said you get annual
Yeah.
gynecological exams. Okay. Have you ever had any history of STDs or STIs?
Nope.
Okay. Kind of again going into the more social history. Do you drink alcohol?
I do, but like wine,
Okay.
maybe 1 glass twice a week at most.
Okay.
Yeah.
Kind of more just to wind down.
Yeah, exactly. Otherwise, it gives me sort of a fog in the morning, so it's not worth it.
Okay. Any smoking or tobacco use?
No.
And any illicit or recreational drug use at
No.
all? All right. Do you feel safe at home? I know you said you live with your dog. Do you feel like you have resources if you were to need help or?
Yeah, I live in a great community. Like, I probably haven't ever felt safer where I live.
Good. And some random little tidbits. Do you wear your seatbelt?
I do. Yep.
Okay. Do you ride your bike at all? I know you said that you were pretty active.
Yeah, we bike a little bit.
Yeah.
And I always wear a helmet.
Good.
Yeah.
Good. And then it's kind of a random thing, but do you have smoke detectors in your home?
Yeah. I feel like the anxiety contributes to making sure I'm constantly taking precautions with my life.
You know,
That's a good
sometimes
thing.
it's helpful.
Yeah,
Sometimes it's
exactly.
helpful. There's a positive and negative to everything.
Exactly.
So other things I wanted to go over, I just kind of want to go over like the review of your body and make sure that there's no other symptoms that we're missing that could possibly be contributing to this illness. Are you having any head pain, any difficulty sleeping?
No, not really. I mean, no more so than I probably normally would, but this exacerbates it just a little bit.
Okay. No chest pain, shortness of breath, difficulty breathing, difficulty swallowing?
No, none.
Okay. Any body pains, any rash, fevers, chills?
Nope.
No difficulty urinating or passing stool? You have normal bowel habits?
Mm-hmm.
Okay. Other than that, I kind of would just like to go over some recommendations I have.
Yeah.
I think that what it sounds like is seasonal allergies.
I would totally agree.
I would like to go ahead and talk to my supervising physician to make sure that I'm doing everything correct and that I have the right assumption. But from here, I think that since you've tried some over-the-counter medications and they seem to give you a little bit of relief, maybe we could start you on prescription medication like Singulair to try and help alleviate those symptoms a little bit more and maybe for a longer duration. Also, just since you do have asthma, I don't want these allergies to cause an asthma attack, so I want to make sure that you have an up-to-date albuterol inhaler just in case, and then maybe see if you need Advair if it's causing any wheezing. It sounds like it's not, but I would just like to be safe, you know.
Yeah, absolutely. I
Sorry.
appreciate that.
And then I think the best thing that we can do is actually get you in contact and refer you to an allergist. You know, Austin's got like 70 million allergens that one can have. So an allergist is really helpful with kind of pinpointing and locating what specific things you're allergic to and kind of helps you know what triggers to avoid and also when your high times of allergy season are for you so that you can know when to medicate appropriately.
That sounds great. Yeah, absolutely.
Sound good?
Yeah.
Is there anything else that I can help with?
No, I really honestly appreciate you so much.
Great. Well, JD, it was so nice meeting you.
Nice to meet you too.
Thank you so much for coming in today, and I'm really happy I got to talk to you.
Me too. Thanks so much.
You're welcome. Bye-bye.
Bye.